The next set of diseases we're going to talk about are all sex-linked diseases. And because they are all sex-linked, we've learned about them already, they are all sex-linked recessive. So, the only way you can inherit hemophilia is if you are female and you are homozygous recessive, or if you are male and you inherit a recessive H on your X chromosome. If you have hemophilia, then your blood does not clot. Okay, there is something known as the human clotting factor that we all produce, and which allows us to stop bleeding and produce a scab over any cut. A person who has hemophilia does not produce any or enough of that to stop bleeding. So they continue to bleed for a very long time, or if you bump into things, can oftentimes get a lot of bruises, and pretty severe ones, like this man, he fell and he's got bruises all down his side, as well as this little baby. Okay, another complication is pooling of blood in your joints, particularly in knees and elbows. Those are called clubbed knees or clubbed elbows. And the only way to stop the pooling of blood in these areas is if it's physically drained out. Okay, so how can you treat hemophilia? If you are diagnosed with it, you will receive clotting medicine. So the human clotting factor. And what's your outlook like? It's relatively good as long as you are mindful of your environment. Okay, you're very cautious. You try not to get paper cuts. You try not to bump into things, stuff like that. And it's pretty good if you avoid any elective surgery, because surgery, you are cutting yourself open. So if you're a person with hemophilia, you're not going to want to do that because there's a very good chance that you could die during that surgery. So that's hemophilia. The next disease is color blindness. And color blindness is also sex-linked recessive. And what that means is that you have an inability to differentiate between certain colors. Red-green color blindness is the most common. So a person who is colorblind cannot tell the difference when you have red next to green. So this little GIF up here at the top, it shows you what normal color vision looks like when you look at crayons in a person who has color blindness. It's very monotone, just like this girl down below. She's wearing a bright red dress in the middle of a green field, but if you're colorblind, it's going to look like her dress and the field are pretty much the same color. So when you're diagnosed, you will be able to get assistance with organizing your things. I had a cousin who was colorblind. We just thought he had really bad taste in clothing. Turns out he was colorblind. And so what we did was we went through and we organized all of his clothes by color. And now he often buys a lot of things with patterns so that when he sees that pattern, he knows that it's a particular shirt that goes really well with another pair of pants, something like that. And really recently, they've also been able to develop these corrective lenses, like glasses, that a person who's colorblind can wear, and it's able to remove some of the wavelengths and allow that person to actually differentiate between the two colors they have a difficulty doing that with. But overall, you can live just fine. You can have almost every job, except you can't be a pilot. But other than that, you're fine with color blindness. The next couple diseases are all chromosomal diseases. And the first one is polydactyly. And polydactyly is a chromosomal disease that is caused by non-disjunction, or the failure of chromosomes to separate appropriately during meiosis. And specifically, this failure to separate appropriately is related to chromosome number 7. And oftentimes it's called aneuploidy for chromosome number 7, which aneuploidy just means an incorrect or an abnormal number of chromosomes. Usually it's caused by extra chromosome 7, and that results in having extra digits. So extra, I said hands and feet, but what I really mean are fingers and toes on your hands and your feet, like the image above and the one below. This guy has an extra finger, which you might not have noticed, but he actually has what looks like an extra pinky on each of his hands. If you're polydactyl, you don't necessarily have any great skill associated with the extra fingers and or toes. They can function just fine if there's bone and blood circulating to them. However, if the blood vessels haven't quite reached it, or if the bones haven't quite fused, or if it's aesthetically unpleasing, you can have surgery to get those extra fingers and toes removed. But other than that, you live just fine. The next disease is Down syndrome. We've learned a little bit about Down syndrome with our karyotyping notes, and Down syndrome is again caused by non-disjunction, specifically trisomy 21. And a couple characteristics that are specific to Down syndrome include the recognizable facial characteristics, which include the extra skin flap over the eye, which gives the person with Down syndrome that characteristic eye shape. Also the stunted nose. Usually they also might have poor vision. You might see a lot of people with Down syndrome having glasses. Another characteristic is the folds of the hand. All of the folds in your hand are determined by your dexterity, or the ability for your hands to fold and move. A person with Down syndrome usually has stiffer hands, and they don't have the fine motor movement that other people might have. And because of that, they don't usually have the two main creases in the palm, but instead have one crease in their palm. Don't freak out if you just have the one crease in your hand. You just might not have the dexterity of that compared to somebody else. And then there is, of course, the learning and the mental disabilities associated with Down syndrome. On average, a person with Down syndrome rarely exceeds an education past a 6-year-old. And there's no way to treat this disease because it is a chromosomal disease, and oftentimes it is associated with shortened life expectancy because there is poor health and immunity with a person with Down syndrome, and also because they are dependent upon relatives, and those relatives don't always keep that child or are able to maintain care of that individual throughout their life. The next disease, Turner syndrome, again caused by non-disjunction, specifically monosomy X, so they only inherit one sex chromosome. Some of the characteristics, they're going to be much shorter than the average female. An average female height is about 5'5" or 5'6". They often have a webbed neck as well, so they have extra skin that goes from behind the ear down to the shoulder blade. They do not go through puberty, and because they're unable to go through puberty, they do not go through menstruation, and that's all because they have underdeveloped reproductive organs. So if their ovaries do not mature and they do not go through puberty, they are sterile. So they're unable to make any egg cells, and they will never be able to biologically have their own child. However, if you are diagnosed with Turner syndrome, you can seek estrogen therapy that can help you produce breast tissue and become more feminine looking overall by receiving estrogen therapy because they don't produce the extra estrogen since they don't go through menstruation. And they're female. The last disease is Klinefelter syndrome. And Klinefelter syndrome, similarly to Turner syndrome, is caused by non-disjunction, but this time it's a trisomy for your sex chromosomes, and they have an extra X. They are biologically male because they have a Y chromosome, and much like Turner syndrome, they don't go through puberty because they also have underdeveloped reproductive organs. But in this case, instead of the ovaries, it's the testes. And since they don't go through puberty, they don't produce any armpit hair, facial hair, chest hair, pubic hair, etc. And they are also sterile because they're unable to produce sperm. However, to help with the deepness of the voice and produce some of those facial hair, a person with Klinefelter syndrome can receive testosterone therapy to help alleviate some of their symptoms.